Very good afternoon and welcome to our broadcast. My name is Tulin from Green Mind Health Consultancies, and my broadcast partner today is Mr. Rami Al-Khalil. He is Master of Psychology. So we have our second episode today, and we will talk about post-traumatic stress disorder, also called PTSD. So, Mr. Rami, please tell me, what is a post-traumatic stress disorder?
Unfortunately, the life is full of events, painful events, shocks, traumas, accidents, wars, crises, natural disasters. And in these painful events, most of people overcome the painful events, but others cannot. And the others who cannot overcome these painful events, who's the one will suffer from PTSD.
So, in general, who can get PTSD?
In general, the people experiencing or witnessing the war situation, traumatic situation, experience or witnessing sexual abuse, physical abuse, all these events, maybe the ones have and suffer from PTSD.
So, what are the signs and the symptoms of PTSD?
The first symptom is re-experiencing flashbacks. The people who has PTSD, they relive the traumatic event again, mentally, emotionally, and physically, increasing the heart beats and also sweating. And as they live the traumatic event again. Also, they can suffer from nightmares related to traumatic event. The second symptom, avoidance. They avoid or stay far away of the places that are related to the traumatic event. They also for images, for videos, for thoughts, they avoid
to go to the same places.
Yes,
probably.
to go to the same places that
Yeah.
the accident or the trauma happened. Also, hyperarousals and reactivity symptom, cognition and mood symptoms.
Okay. How do children and teenagers react to traumas in general?
For children and teens, they suffer from severe and extreme reaction. They wetting the bed. They wetting the bed after they have learned how to use the toilet. They also acting out the painful event when they are playing. Also forgetting how to talk or unable to talk. Being usually clingy to one of the parents or to a relative.
So let's talk about the treatment.
Yes.
How can we treat PTSD? What kind of treatment do we have?
For treatment is very important for a person with PTSD to go to mental health professional. Also, to go to ones who have experienced with PTSD and trauma treatment. Yeah, most type of therapy used in treatment PTSD is psychotherapy. And
Combination.
and medication,
Yeah.
or medication between psychotherapy and medication. This is according to the case situation and the level of severity of the case.
And probably also to the client or patient, because some people probably would say, no, I just want to start with psychotherapy, and others would say, yeah, I would like to combine psychotherapy with medication.
Yes, this is according to psychologist assessment and psychiatrist assessment. After assessment, he can make decision about that. Also, يعني, there is a type of psychotherapy called NET therapy, narrative exposure therapy, and EMDR therapy. They always used for treatment the people who suffer from PTSD.
So can you tell me something about the duration of the therapy? I mean, what do you suggest? When someone comes with a PTSD, how many therapy hours or how many weeks, months would you suggest?
Yes. It's يعني for the time it's took about between 6 to 12 sessions. This is a weekly session. Maybe it will be a one-to-one session or a group session.
Group session, yeah. And what are the common types of therapy? You were talking about one. So are there other common types of therapy concerning PTSD?
Yes, as I mentioned, there is net therapy, also cognitive therapy, and restructuring the mentality, how they manage and how they think about the traumatic event. By psychotherapy, they can change the way they can thinking about against or toward to the traumatic event.
Okay, I see. Yeah. So my final question concerning this topic would be, well, unfortunately, we do experience so many war cases at the moment worldwide. As an example, we have there's a war in Ukraine, Yemen, Syria, Palestine. I would like to ask you concerning Palestine. Well, if a war goes on for several decades, do you think people can recover? I mean, we're not talking about only 1, 2, 3 decades. We're talking about actually 4 or 5 decades, even more or less. What do you think about this kind of situations that we see in Gaza now, in Palestine in general? What would you recommend when you, let's say you would work with people in this long-term war situation? What can you recommend?
Yes. If we go to chronic PTSD, we should know that chronic PTSD will not go away itself. It need to be treated, and يعني by the time it will be less severe, but it still interferes with social settings, with work duties, and will affect in the life. And if still not treated, it will affect in physical and mental health for the person.
So you would say there is not a chance to recover 100%. I mean, to fully recover, right? When we talk about, let's say, Palestine, because it's just the situation is just too long going on, so the person might not be able to recover fully, right?
Yes, for يعني Palestine case is there is a war continuing war.
Unfortunately.
The treatment need a stable situation, and after that we can begin treatment. But in this case, the war is continuous, and it's very hard to see every day, not just the building destroyed, also the human and the civil people is harmful psychologically and physically.
It's like a not ending nightmare, right? It's kind of
Yes.
continuously nightmare, so it's very sad. Mr. Rami, thank you very much for your answers, and thank you very much for watching. Please, if you have any questions or any other information you're looking for, contact us. We are located in Business Bay, Green Mind Health Consultancies. We're here for you all the time, every day. Thank you so much.